early on Channel 9, you heard a discussion today about Jackson on Oprah. People in the audience talked about a number of issues, including his plastic surgery. Many say it's something they've done themselves.
How many have you had?
6.
You've had 6 plastic surgeries.
No.
That were being made against
I
him.
was shocked because
Jackson claims he's only had 2 surgical procedures on his nose. Now, nose reshaping is the most popular form of plastic surgery, followed by liposuction, right?
And that's right. And until recently, more deaths were associated with liposuction than any other kind of plastic surgery. In all, 95 people have died undergoing that procedure. However, it has gotten significantly safer now, and one local hospital has just started using a technique that is said to be the safest yet. A woman from Charlotte allowed me to follow her through the process.
She said about a week and a half.
Gabrielle is a successful Charlotte businesswoman. She isn't overweight by anyone's standards, but there are parts of her body she just doesn't like.
I'm very active, kickboxing, cycling, you name it, numerous types of exercise, and there's just certain areas that don't want to go anywhere.
So in less than 24 hours, she will undergo liposuction on her legs and lower abdomen. It's a new type of procedure, and she's optimistic about the results.
Less bruising, less trauma, less recovery time.
Dr. Victor Ferrari is Gabrielle's surgeon, and this is her actual surgery at Presbyterian Hospital in Matthews. Our cameras were allowed in for this breakthrough procedure. Dr. Ferrari says this new way is better because the instrument involved is power-assisted.
With the traditional, you got to hold it like this and kind of ram it in there. Whereas with this one, you can just very gently push it in. And literally, you can just hold it with 2 fingers if you needed to.
He says this gentler method is much easier on the body, causing less swelling, less bruising, and a quicker recovery. But he says it could actually be more dangerous if the doctor is not skilled with the new equipment.
This one, being a little more powerful, requires a little bit more of experience, or else it can really kind of get away from you. You can take out too much and end up with divots and things like that.
But Dr. Ferrari says he's trained extensively with this new technology. Gabrielle's surgery takes a couple of hours. That's pretty quick, and he says recovery will be too.
By being less traumatic, the patients seem to hurt a lot less after surgery. They're usually back to work in a couple of days versus taking 1 to 2 weeks off with the traditional.
Good to see you!
And that's exactly how it was for Gabrielle. She only missed 1 day of work, and we caught back up with her 6 days after her surgery.
I'm not really bruised that much. I bruised right inside here, and no bruising here or here.
She's still a little sore, but overall she is very, very happy.
Well, are you glad you did it? I am. It's exciting.
Oh, it's going to take about 3 weeks for the swelling to go down, and they say about 6 weeks before she'll see her final results. Now, Gabrielle does have advice for anybody who's considering this. She says, do your homework and choose your doctor very carefully. Right now, Presbyterian Hospital in Matthews is the only local hospital that is doing this procedure this way.
I'm going to ask a man's question. How expensive is this?
$3,700, and insurance does not pay for that.
Yeah, okay.